the contributors of chronic disease, because in functional medicine, our main goal is to really help a person to age better, to age well. And in order to do that, we have to look at the body systems in much more than just a disease state. So in other words, we're not just using the reference ranges on the labs, and we're listening to each person's symptoms, their issues that they have, why they're not feeling the best that they've ever felt. And then we dig deeper. We look into these contributors of chronic disease. So, how do we help people in functional medicine? Well, first of all, it's much more personalized and individualized. The appointments aren't like the typical appointment where we're looking for a disease that we can label with an ICD-10 code and give a medication or treatment, diagnostic treatments uh, with, for example, X-rays, CAT scans, MRIs. That is very important, but it's at a certain spectrum in medicine where you need these kind of imaging and where there's a disease already present. But to prevent diseases, especially these chronic diseases, you have to get to the underlying causes, these root causes. So what's so important in functional medicine is to address this whole metabolic syndrome, metabolic conditions, metabolic dysfunction, where we have elevated insulin and ups and downs in blood sugars. And you really can't capture that only on the typical lab tests that are done, which are usually just an average of a blood sugars over 3 months. You really want more of the dynamics of the ups and downs of blood sugars on a daily basis, and actually also what the insulin is doing at the same time. This will tell you so much more about a person's blood sugar control, which really is so important because we have in aging what is known as ages. It's interesting that they use that word because it stands for advanced glycation end products, ages. And what that is this browning of the cell, mostly the cell membrane, that occurs because of the elevated blood sugars and the protein structure of the cell membrane. So between protein and elevated sugars, you get this kind of browning reaction, and it's called glycation. It's kind of similar when you put chicken in the oven and it browns on the skin. That's protein and sugars that are browning and caramelizing. It's the same thing with our cells. So we really want to get to the bottom of controlling blood sugars. Now we use nutrition. Food is always our first move. And then we do targeted nutrients, targeted supplements, targeted vitamins, minerals, herbs, co-nutrients such as enzymes, peptides, minerals, and amino acids. And it's individualized and targeted for what a person needs and how those results are coming out on these in-depth functional labs, where we're not just looking at disease, although that is very important. We are also looking at impaired function. So it's not just looking at when the A1C gets to a certain point and we can label it as pre-diabetic or diabetic. It's finding out why is it going in a certain direction, and how can we use natural lifestyle interventions with diet, environmental changes, sleep and stress type of adjustments, where we're really helping with that whole insulin, blood sugar, and even cortisol, which is the adrenal hormone for stress that is very much tied in to insulin glucose dynamics. We also work very closely at improving the lipids. So it's not just cholesterol. We know now that it's way more than just looking at the cholesterol number. There's underlying inflammation. There's what they call endothelial dysfunction, which comes from the inflammation of the artery lining, which begins the process of the blocking of the arteries, arteriosclerosis. So we want to really approach this at the very point where there's this process ongoing of inflammation, high homocysteine, elevated levels of insulin. Well, then we know that the cholesterol will be breaking down into these small, dense particles that are actually more problematic than just cholesterol itself, which can be protective. So we really want to measure on advanced tests the particle size, which means is it getting into these small, dense particles, and the particle number. Are these small, dense particles increasing in number. And then we see if it's tied in with inflammation and high homocysteine and elevated insulin. And that's how we get excellent results. And then we work on controlling inflammation, which very much is tied into the gut, because when there is a gut overgrowth of bacteria, whether it's Candida, which is a fungus, whether it's H. pylori, a bacteria, or a parasite like blasto, any of these parasites, bacteria, or H. pylori or Candida that's overgrown can cause inflammation and can cause the immune system to be overreactive. Very important to address gut health, and that's a very important part of our functional medicine. So we're working on these different components of underlying causes of aging. We also look at thyroid health much more in depth than the typical look into the thyroid that is done on a general visit, because we want to see how the hormones are on an optimal level. So we need to know if some of it is being tied up, so it's not actually being used, or there's a conversion issue where some of the hormones need to be converted to the active hormone, and that's not happening. So we can help with that with lifestyle, nutrients, diet, and food, and different types of removal of environmental toxins to help with that conversion of the thyroid hormones, and also to improve adrenal. That's your cortisol. Sometimes it's up and down the cortisol levels. We really want to make that proper cortisol um, curve, which means it's higher in the mornings, but it gets lower as the day progresses until it's very low in the evening, and that's not always the case. So we really need to improve cortisol because that goes along with insulin. We also want to improve what's called methylation. That's going to be really in depth with nutrition and environment and lifestyle, because that process includes your neurotransmitters, includes detoxification from environmental toxins, and it includes the growth of our DNA, the reproduction of our DNA to reproduce healthily. So methylation is involved in every cell, very important to detoxify, even to help remove our hormones. So we really work at improving that process of methylation by measuring it indirectly or directly. We also kind of monitor it to know that we're improving this process of methylation, so that in turn will improve so many different systems in the body, because methylation is involved in many different systems. That's a major factor, a major focus in our integrative practice is methylation. And we also do food sensitivity testing and gut microbiome testing to really get into that gut health, so we can help to improve inflammation and the immune system from being overreactive. So these are just some of the contributors of chronic disease that we really focus in on. The other part that I would like to mention is optimization of vitamins and nutrients. So we do tests for a lot of vitamins and minerals. It's very important not to just be at the minimal levels or to be in the range, but what is the cell using? And we can tell that by doing functional testing of the byproducts of where these vitamins and minerals are being used. And if those byproducts are elevated, then we know the body's not using these vitamins. It's not just testing the serum levels, it's the actual way that the body is using these vitamins and minerals. It's a very important part of aging well. So what's also important is incorporating very good nutrient dense foods and fats, the right fat. So we do a lot of cell membrane fatty acid testing with the omega-3 to omega-6 ratio. It's very important to really improve the good fats and to help with inflammation, to help with aging well. So if you have any other questions, please reach out to us at South Florida Integrative Health Center. Our website is there listed, and that's how you can make an appointment or a 15-minute discovery call. And I hope you find this helpful. Everyone have a great